I'm a clinical immunologist and immunopathologist at Kalan, and I'm also the medical director for the Kalan COVID vaccination program. And one thing by getting vaccinated is that we can show that we are responsible citizens by protecting our own family members, the community, the country, and the humanity as a whole, because that is the only way out of this pandemic. So vaccination utilizes a strategy whereby you deliver a portion of the virus to the host immune system, which is the human immune system, in a way that it actually cannot cause the disease, but is itself enough to produce an immune response against the infective organism. So we already had the genetic structure available of this virus. And thankfully, SARS-CoV-2 had more or less a very similar genetic structure. The second was that, and hence we could produce the whole genetic makeup of this virus within 1 month of the pandemic starting. The second reason why this happened so quickly was due to the advancements in the various genomic technologies, whereby once you know the genomic structure, you could actually pick up the various small genetic elements which would code for the proteins which you want to utilize as vaccine components, and then use them in different manners to deliver to the immune system. There are at least 3 or 4 trials which have already been conducted worldwide, and TGA has also approved the use of Pfizer vaccine for the pregnant individuals. This vaccine does not integrate into your genome, so there is no way this can affect your fertility. These vaccines, we are talking about 90-95% efficacy. So they do stimulate your immune system in a big way. So you do have a higher incidence of the immediate side effects. So, like headache, fever, mild fever, sore arm, they are slightly more frequent than one of the previous vaccines. But the ones that we are worried about, which can cause a more severe health problem, are extremely rare. And I'm sure you all know about the thrombotic risks with AstraZeneca vaccine and the incidence of 1 in 50,000, which is still very rare when we are talking about a vaccine which has been delivered so fast and which is so effective. Yeah, well, we see lots of science fiction movies and we are used to all these wonderful things happening. But thankfully, that still remains a fiction. There is no way a tracking device can be injected through such a small needle. So that's a good question, which I get asked very frequently. And I guess an honest answer to that would have to be that Pfizer vaccine does not contain anything. But the AstraZeneca vaccine does use the cell line, which is used to prepare this adenoviral vector. It does use a cell line, which is derived from the human embryonic cell line, which has been in existence for a long period of time. And that is used to deliver this genetic material that encodes the viral protein into the adenoviral vector, which is the virus vector. And then that is used to deliver as a vaccine platform. So there are an extremely minute, if you were to go into very minuteness of things, yes, there is a component of that human embryonic tissue which is used to deliver that genetic material of the virus into the viral vector. The only way out and go back to our pre-COVID, lifestyle is for all of us to get vaccinated.